Warm welcome to our students and staff at the University of Derby to this session of our student lecture series. My name is Dr. Paula Holt and I'm Pro Vice Chancellor and Dean of the College of Health, Psychology and Social Care. And I am really proud to introduce to you our Executive Director of Nursing, Allied Health Professions and Quality from Derbyshire Community Health Services, Michelle Bateman, to present a session which really focuses on care in the community. It's a session that's going to be really helpful and informative to many of us who don't always know that care takes place outside of hospitals as well. So before Michelle starts to present her talk, I'll just introduce her. Michelle started her registered nurse training in 1985 at St Bartholomew's Hospital in London, and following a period of working as a nursing auxiliary at the City Hospital in Nottingham whilst attending college, she went on to complete her nursing and then her midwifery and her health visitor training. And after a period of working as a locality manager, which included development and management of services for older people, she moved back to Nottingham. And since 2000, she's held a variety of posts which have all centred on clinical leadership, quality, risk management and patient experience. She completed a master's in health policy in organisations in 2002, and she held the role of Associate Director of Nursing for Community and Mental Health Services within Nottinghamshire until her appointment as the Chief Nurse and Director of Quality at Derbyshire Community Health Services NHS Foundation Trust in February 2019. She's a Queen's Nurse, which is a great accolade, and is also the Vice Chair of Tuntum, a BME Independent Housing Association in Nottingham. I know Michelle as a passionate nurse, committed to the highest standards of patient care and support for her staff and for patients, and she is very keen to emphasise the benefits of working in the community. And as a nurse myself who spent most of my clinical practice in the community, I can't disagree with her. So Michelle, over to you.
Thank you, Paula, and thank you and welcome to everybody. I am so pleased to have this opportunity to have this conversation with you all. So I hope through the discussions that we have and the presentation, you get a real insight into the diversity, the quality, the wealth of experience you can gain if you were to come to Derbyshire Community Health Services. So as Paula said, my name is Michelle Bateman. I'm the Executive Director of Nursing, Allied Health Professionals and Quality. And what does that mean? That means for DCHS, I am the professional lead for those professions, and I also have the mandate for ensuring that our services are driven by quality. And if you remember, quality is safety, patient experience and effectiveness. Thank you. Next slide, please, Matt. So DCHS, we're really proud to have been recognised as an outstanding organisation by the CQC. And what does that mean? For all of our core services, over the 5 domains of the CQC regulatory visit, so that's safety, effectiveness, responsiveness, well-led and caring, our services were either good or outstanding. And overall, we were accredited as being an outstanding organisation. So why is that important? What it means is that you can be assured of the quality and the safety of our services. And we've been identified as an innovative trust who work hard to make sure our patients have a good experience, as well as our staff members. Next slide. Over the last year, we've been heavily involved in the COVID pandemic, as have organisations up and down the country. But for me, our results of our 2020 staff survey are a real accolade for DCHS. Despite the context in which we are working, 87% of our staff said they would recommend the standard of care and treatment provided by DCHS if a friend or relative needed treatment. And 75% of our staff said they'd recommend DCHS as a place of work. And that is phenomenal. We're really proud of our staff and really proud of the services that we provide. And as you'll see through the presentation, really passionate about community services. And I'll come on to that a little bit later. Next slide, please. So this video was done by the Queen's Nursing Institute, and as Paula said, I am a Queen's nurse, and the Queen's Nursing Institute is a charity that was set up to really champion community services. So this is a video they put together, which I'd like to play for you now. Thank you.
Okay, you can tell me when you want me to start.
We already started.
You've already started?
Yeah.
My colleague said to me, why do you want to be a community nurse? And I said, well, because I want to be able to spend more time with my patients. I want to do a varied job. I don't want to be on a ward, the same ward every day. I like planning my day the way I want.
It's helping people. It's making a difference and making sure people that want to stay at home are able to stay at home.
We do see patients from 18 to the grave.
And we do any kind of care that requires a nurse.
And you couldn't really look at what's on your piece of paper and predict how your morning's going to go, which is probably why I quite like it.
And although I'm doing something which probably isn't very nice, which might hurt, or, you know, they still enjoy seeing me. And that's why I wanted to be a nurse, because I wanted to make people happy. I might cry in a minute. Bill? You here? Hello, Bill. There we go.
I'll be all right in a minute.
Head up. Bum in. I don't want to just go in and look after someone's wound. I'm looking at where they're sleeping, what they're eating, how they're mobilising, providing them spiritual support if they need counselling. You know, I'm seeing the whole picture that could be affecting their healthcare.
When I start kicking.
Don't you kick me?
No, I will do. No, that's the trouble when I lift my leg.
Woo!
I can't stop it.
It's all right, don't worry about it. I only went to the gym yesterday.
You started me off now, big time.
So I've in district nursing now, over 23 years. Wonderful, love it, absolutely amazing.
Okay.
Well, to me, it's been a lifeline. It breaks your day to have someone come in that door, especially when you're very poorly.
Shirley, your tummy's misbehaving again.
See, to me, we're like friends now, aren't we?
We are.
So, she torments me and vice versa.
We in-reach into both hospitals to vulnerable adults. So anyone who is street homeless, sex working, asylum seeking, and more recently gypsies and travellers.
Okay. So we have a bed for you at the crypt, and we'll catch up with you in the morning, and we aim to come every day if we can and touch base with you and see what we can do to support you. That's our primary contact, is when people are admitted to hospital. But that doesn't mean we won't stop and talk to people who we see when we're walking across the city. It's getting cold now, though, isn't it? You know, there's a homeless practice down the road. You know. I think everybody is somebody's somebody. Everybody is significant to somebody. You know, they're a person. People deserve to have a chance. And and I feel privileged to be able to do that.
I met a nurse who said, why don't you do nurse training? I thought, you know, it's all women and I'm not young anymore, and also I can't afford to do it because I have to be a student for 3 years. Well, for each one of those she said, well, that's not true and you'd be good at it. So I did it and here I am now. I've just finished my training and I'm just starting my new job in my first week.
It's a great job, but it does come with its very own, with a lot of responsibility, working autonomously, so you are every day making decisions regarding patient care and treatment. Yes, there are parts of the job that are tough, quite emotionally, because we are dealing with patients towards end of life as well. But we have some days, like today, we go to an exercise class, and it's not all doom and gloom. right at the top end of your heart rate target, which is fantastic.
Yeah?
Yeah.
Oh, good stuff.
But working in the community's been a great move for me. Fantastic. It's, like I say, it's opened up so many more learning opportunities.
I've not only developed more since I've come to the community than I ever did in hospital, I've got a lot more skills than I ever did. It's completely changed my perception of district nursing.
See you. And they're not just nurses. They'll come and sort you out with whatever problem you've got. They've got the answer.
Often the perception of people working in the hospital is if they move into the community, we don't use advanced nursing skills, but we use every range of nursing skills that you can imagine. The most important one is communication, but everything else, so injections, nasogastric feeds, intravenous drugs, assessments, advanced assessment skills, prescribing, leg ulcer care, long-term conditions care. It's a place to learn. It's a really good place to learn.
Make sure that it doesn't catch on the other bag, but just on the tip of your finger, just use it to go round. Yes, brilliant.
So sometimes the nursing aspect is not what is worrying the patient, it's the psychological aspect. So when we do holistic care, we're taking in consideration the whole person.
So we can talk to you about it now, when I can. Finally, because I don't.
Too close.
Yeah.
You know you can talk to me. Go on. Fire away.
Oh no, I'm not.
Yes, you must. Go on.
Yes, last year talked to me about memory boxes. It's just something I need to do because we have a 13-year-old son. So I'm unlikely to be here for his 14th birthday. So we're talking about what we can put into that and how to do that. So it's not just clinical, not just medical. The most salient point that stuck in my mind from that conversation yesterday was that she said, remember, the memory box is not just about you giving to others, it's about for you receiving from others. Which took me to a nicer place. And that's district nursing.
I wouldn't want to do anything else. I wouldn't want to do anything else. I get up in the morning and I'm ready for work.
I think it's a grand job, and there are lots of different community nursing jobs out there, whether you want to specialise or not. I would never discourage anybody from working in the community.
And that we keep a lot of people out of hospital because we pick up on things quicker, because we know patients so well.
I love my job. I don't think there's any job quite like nursing in the world.
It is. Sometimes I think, oh, I'm a bit sad. How is that? I've been doing this 35 years and I still love coming to work. But I do.
And if you're like me and you want to spend more time with patients and do what we're trained to do, which is deliver holistic, compassionate care, then community nursing is by far the job for you. It's like an advert.
What do you think of the district nurses when they come in? Lovely. They are lovely, aren't they? Absolutely brilliant. It's like having another friend. So it helped me a lot, actually.
They are lovely.
There need to be more district nurses. That, you know, we need more. So if you look at the health service, this is called primary care. We can't manage without hospitals, but absolutely you can't manage without district nurses.
Thank you, Matt. So hopefully that would have given you an insight into a career within the community. We at DCHS are extremely passionate about saying to students, regardless of what year you are in your training, please consider the community as a first career following your completion of your training. As you can see from the video, there's so much that you can learn from being in the community. For myself personally, as Paula already alluded to, as soon as I finished my training in the hospital, I knew I was going to step into the community. I took a different route. I went down the children and young people route, and I really enjoyed being a midwife and becoming a health visitor, and I've been in the community ever since then. Since my time when I was training, people have always been talking about care being closer to home, care being in the community, etc. And with the most recent white paper and the long-term plan, never more has there been a time when we're really committed to making sure that people are treated as close to home as possible. We do know that the longer people stay in hospital, the more likely they are to decompensate, pick up infections, chest infections, mobilisation becomes diminished, UTIs, etc. So there is real evidence base of why we should be treating patients in their home environment, and we're all committed to that. Next slide, please, Matt. So just a few facts for you. 95% of all healthcare is initiated in the community. And people do forget the wealth and the breadth and the variety of care that's provided in the community services. And my colleague Joe's going to expand on that a bit later. Within the community, we provide services from the cradle to the grave. We don't have community midwifery within DCHS, but our health visitors go in antenatally, so they go and see the mothers before the baby's born, and then they continue the care up to the age of 5, when it's then transferred over to the school nurses. For our community services, we do a lot of end-of-life care. Again, it's one of my passions to make sure that patients who are dying are allowed to die in the place that they choose. Now, that might be hospital, it might be some other place, but people very rarely get the opportunity to choose where they want to die. We provide our services within a wide range of settings. Most people know that we do care in homes, but we have clinics, we have community centres, we have schools, services are provided in leisure centres if it's appropriate. And the fifth point on there is the most important point. You do not need to have acute experience to work in the community. And one of my colleagues later on will talk about the support that you can be guaranteed should you decide to take the path into the community services. I, for one, am passionate about community services. It is such a rewarding career. I've loved every moment of it. Yeah, that's all I can say, really. It is the best job. And being in the community, working with people, you see people at their best, you see them at their worst. But you see people in the setting that they're most likely to be living in, rather than the artificial setting of the hospital. Next slide, please. So I'm going to let Charlotte tell you her experience of coming to work within DCHS. Thank you, Matt.
My name is Charlotte Morley and I currently work for DCHS as a community nurse. My journey started in last April 2020, just as the coronavirus pandemic was starting. I was one of many student nurses in their last 6 months before qualifying who got the option to opt in. I chose DCHS because that's where my job offer was and I always wanted to work in the community. I was placed in the Overdale team. The Overdale team have been nothing but supportive since I've transitioned from being an aspirant nurse to a newly qualified. No question is too silly and they've been amazing and I can't thank them enough. I think they deserve to be named, so their names are Thomas Davidson, Gemma Bucknell, Rhiannon Thomas, Andrea Breaston, Sue Cropley and Marie Ward. I generally can't thank these people enough for being so supportive.
Thank you. And then I'll hand over to my colleague, Joe. Thanks, Matt. Next slide.
Hello, I'm Jo Hunter. I'm Deputy Chief Nurse for DCHS. My background, I've worked in the community now for approximately 34 years, of which 14 were in midwifery and the next 20 years in the community trusts in Derbyshire. I didn't intend to work in the community initially, but it has been the most rewarding place, I believe, that I could have worked. And I think the important thing to remember is that there are a huge number of opportunities for nurses in the community. You don't have to be a district nurse, you don't have to work in community nursing teams. There are loads of opportunities that we can assist you to fulfil. Next slide, please, Matt. Derbyshire Community Health Services is one of the biggest community trusts in England, and I think what you need to remember is that we range from very rural settings in High Peak to intensively city centre settings, which have a wide range of challenges. So we do have rural poverty, but we also have houses of multiple occupation, and we have a wide range of settings in between. So the breadth and knowledge that we need of our patients is huge. We have a significant number of colleagues. We are operating not just in people's homes, but also we have 7 community hospitals. We have teams who work out of 30 health centres, and we actually directly provide 3 general practices. So you can see that the range of nursing opportunities is huge. And as Michelle said early on in her presentation, 98% of our patients would recommend their services to their loved ones, which is a real tribute to the care that our not only nurses but all of our clinical teams provide. Next slide, Matt. So here we have all of our operational services, and you can just see from those the huge range of services that we provide. And in addition to these services, we also provide a number of corporate nursing functions. And certainly the teams who are responsible under me provide infection prevention and control, tissue viability, we provide patient manual handling advice, and also the clinical and professional standards support across DCHS. I think when you think about community nursing and then you look at the range of services that we provide, it's really easy to see why there really is something for everyone. And the opportunities to be able to change your career within an organisation like DCHS is also enormous. And the other group of nurses that we have nurses who work in the training teams, and later on Faith will talk to you a bit more about what they offer. But we also have a very strong clinical effectiveness team, and we're really keen to support research across the whole range of community nursing. And there are lots of opportunities in order to promote best practice and really get involved in quality improvement. Next slide, please, Matt. So here we have what are the current nursing opportunities in DCHS, and you'll see on there that there are a number of areas where we're really trying to develop the nurse associate role. So not only are there supportive opportunities for registered nurses, but there are plenty of opportunities for nurse associates to develop their knowledge and skills. And where we have got nurse associates in place, it is working really well, and they have the same opportunities for development within the scope of their practice as their registered nurse colleagues. When you look here as well, you can think back to the slides and the video from the Queen's Nursing Institute that Michelle provided, and you can see the range of skills that are being used. And traditionally, the work of our advanced clinical practitioners and the OPAT nursing team, which is the community IV team, they are skills that traditionally were used predominantly in acute hospitals, and this is a really good example of care being moved into the community to really support people to be cared for in their own homes. In terms of our community hospitals, we have a number of wards, and in common with colleagues in the community, the patients that we're looking after on those wards are more acutely ill than perhaps they were 10 or 15 years ago. So where people want to be hospital nurses, there are opportunities to work in the community in ways that are slightly different to the acuity of those wards, but they're still busy wards. We have older people's mental health wards, where we're dealing with people with predominantly dementia, but again, the balance of those patients is changing, and we do now have a number of younger patients with functional mental health issues. And we also have inpatient and community learning disability services in the north of the county of Derbyshire. Then when you look at our outpatients teams, we have a wide range of people who provide outpatient clinics. Our wound clinics now are well developed. They're a fairly new development, but are running really well, and we recruit nurses to work specifically in those clinics, and we have a large and very well established sexual health service, which again helps our population and sees a wide range of people, right through from young people right through to people struggling with the menopause, and all sorts of sexual health services in between. And with that, I'd like to hand you over to Mary Heritage. Oh, sorry.
We have the next slide, Matt.
There's a video first, I think.
We've watched this video. Okay.
Hi, I'm Lauren, and I'm a community staff nurse based in Chesterfield. During my third year at university, I joined DCHS at the start of the COVID pandemic as an aspirant nurse in April 2020 before qualifying in August of the same year. Due to challenging times, staffing issues and workload capacity, I was unable to sign off my competencies. However, I have had the opportunity to access the CPF support in order to gain these vital competencies. With the help and support of CPF Laura Williams, I was able to gain vital knowledge with compression bandaging and wound care. I've also been actively involved in the preceptorship programme for the last 6 months and found these forums to be invaluable not only to my transition from aspirant nurse to newly qualified nurse, but also to my mental health. The forums are a great opportunity to meet newly qualified nurses, as well as DCHS employees from other disciplines and those new to the community. The forums provide a platform for all participants to share their experiences and knowledge. The guest speakers also provide an insight into different clinical topics which are key to personal development. Thank you.
Hello, I'm Mary Heritage, and I work alongside Michelle and Joe, and I'm leading the allied health professions in DCHS. I'm actually a speech and language therapist, and most of my career I've worked in community settings, eventually specialising in dementia care. I always loved the variety and the autonomy and independence that this gave me. But overall, as we saw in the video, I found working with people in their own home environment and with their whole family to be by far the most effective and rewarding way to use my clinical skills. In DCHS, I've been supported to progress my career into a more senior role, and I'm currently seconded 1 day a week to be the chair of the Royal College of Speech and Language Therapists. So I'm going to tell you a little bit more about what we have on offer in DCHS and in community for the range of AHPs. Next slide, please, Matt. So there you have the full set of 14 allied health professions who are registered with the Health and Care Professions Council. And in DCHS, we employ the 5 physio, OT, podiatrists, speech and language therapy and paramedics. Next slide, please, Matt. We have over 600 allied health professionals in our trust, and that document shows the allied health profession vision that we co-produced and covers all of our roles. It describes how we can have the maximum impact for the people of Derbyshire. Thank you. Now I think we've got a video clip from my colleague Lauren, who's an occupational therapist. Thank you.
Hi, my name is Lauren, and I have had the privilege of being an occupational therapist for the last 16 years. I've had a varied career from elderly mental health, inpatient rehabilitation, and on into community therapy. I have progressed from a Band 5 up to a clinical specialist, and I am now a team leader for a community rapid response team. Working as an OT within the community is really exciting, and every day is different. It allows us to utilise all of our OT skills to support the patients to meet their goals, whilst remaining living in the environment that they call home. You're able to build a therapeutic relationship working on goals that matter to them. It enables us to enhance our skills by working within an MDT to enable us to be the best therapists we can be. Moving to work in the community was the best career decision I made, and I would recommend it as a rewarding and fulfilling career.
Hi Mary, sorry, you're muted. Can you just unmute yourself?
I had to be the first one to do that, didn't I? So allied health professionals, as Lauren said, have opportunities to work across a whole variety of community settings, in our rehab beds and beds with care, in clinics, homes, schools and our urgent treatment centres. Next slide, please, Matt. There's the whole range of clinical roles where we have therapists and others working, and as you can see, that list has increased in the last year or so to include long COVID clinics and our vaccination clinics. Pan of eggs. Allied health professionals are particularly skilled at working in integrated teams, for example in community rehab and in our rapid response teams. We've got a key role in managing patient flow between hospital and patients' homes to ensure that people receive care closer to home, and also in specialisms, learning disability, older people's mental health, neurology, respiratory and musculoskeletal, as well as our urgent treatment centres, where we work as a crucial part of the multidisciplinary team. So why the pan of eggs? Well, in an integrated team, each professional has their own core skill or their yoke, which must remain intact to get the best impact on patient outcomes. But we also learn other competencies from one another. That's more like the egg whites, which ensure that care is seamless. Thank you. And now another colleague, Luce, is going to tell us about her community career as a physio.
Hi, my name's Lucy Cocker. I'm a team lead physiotherapist working within the physio, OT and MSK outpatient services at DCHS. I started with the organisation back in 2016 as a senior physio working in MSK outpatients, and then over the next 18 months developed into my team lead role, which is working on the operational management of staff and departments whilst also carrying a clinical caseload. Working for DCHS or working in the community in general is a great place to be. With the NHS long-term plan, there's a big focus on community services. It's a really innovative place to be. Lots of involvement in service improvement, and we work closely within our governance structures to make sure that we're providing the best care that we can for our patients. Not as slow paced as some people's perception might be of the community. So I certainly haven't felt that during the pandemic. I would encourage anyone to come and work in the community, even if you've never worked in that area before. There's lots of support available for new starters, and it's just a great place to be. All right, thank you.
Thanks, Lucy. I'm going to pass over to my colleague, Faith.
Hello, good morning. So my name is Faith Sango. I am the head of people development in DCHS. I qualified as a mental health nurse in 2004, and I have worked in acute mental health, psychiatric intensive care, and in long care services across Derbyshire. So my role in DCHS is to make sure that when you qualify as a newly qualified nurse, and you come into DCHS, we've got enough support to develop you and to support you to advance your career. And also to make sure that as soon as you get to DCHS with your PIN number, we give you the basic training and skills that you need in order for you to be a safe, newly qualified nurse. Next slide, please, Matt. So I just want to talk to you briefly about some of the things that we will offer you as students in DCHS. So one of the things that we offer as soon as you come into DCHS is tailored workshops for students. The way this works is if there's an area of interest that you want to explore in DCHS, you let us know, you tell us about it. We can actually put together some forums and invite speakers to come and discuss any of the areas of interest. You might have your placement in sexual health, for example, and not have an opportunity to go to our MSK services, but if it's an area of interest, that's some of the things that my placement team can do to support you. We've also got interprofessional student forums across DCHS. So this is where we have student nurses and student AHPs coming together every so often just to talk about practice, look at case studies, help with reflection and discussions around your placements, how it's going, and learning from each other. And these are quite important for us because it helps us bring you together as learners in preparation for you joining us into DCHS as nurses and AHPs. We've also got reflection sessions that we provide for you, and a lot of these tend to include a clinical supervision session at the end of each reflection session. We actually encourage all our nurses and AHPs in DCHS to make sure we access clinical supervision. As you'd have seen in some of the videos that you watched earlier, some of the people that we look after come with a lot of complexities, and it's always good practice to reflect and to discuss how some of the complexities may have an impact on you as a student nurse. So we strongly encourage clinical supervision, and we've got practice learning teams and CPFs, practice learning facilitators, who can support you and provide this for you. And one of the things that we always say to your students is, if you start your reflection in your clinical supervision now as a learner, it will make life so much easier when you transition into a qualified nurse or AHP and you start looking at evidence for your revalidation. So another thing that we offer is joint peer learning sessions around body systems. So if you come into one of our inpatient wards, for example, at Walton or at Ash Green, if there's a more senior student on that ward, we tend to buddy you up so you can support each other. And you also get an opportunity, if you're in the community, to have joint peer learning sessions when you attend reflection sessions and clinical supervision. We've also got, we know that a lot of you are coming in, with your dissertation topics, and we do support this. If you're coming in and you're thinking, oh gosh, I don't know where to start, you can talk to our clinical leads, you can talk to our practice facilitators around what is new in clinical practice, what is it that's challenging at the moment around community care, and we can support you and guide you with that. We've also got a research team in DCHS who don't just support qualified nurses and AHPs. We actually encourage students to utilize all of our services that we offer to staff. One of the things that we pride ourselves on around DCHS is, as you come into DCHS, you are not just Derby University students, you are our students as well, because 50% of your time is spent in practice. So we look at you as a group of DCHS students as well. And in terms of our evaluations and feedback, you've heard from two of our aspirant nurses. As a trust, we get a lot of really, really good feedback. And also, we like you to tell us what's not working for you. We like you to tell us what we can do to improve your experiences, because we know that if your experience is impacted, it also impacts on patient care. So we value your feedback and your evaluations. And when you get to that opportunity and you're asked to complete the NSS feedback, please take time to complete that, because it helps both the university and the trust as well to improve experiences and what we offer to you. As DCHS students, you've also got access to our staff and wellbeing services in DCHS. For some of you who've attended our student forums, we tend to invite our staff and wellbeing to come and talk to you about how you're feeling and what's going on in DCHS, and you've always got access to this group of staff to support you during your placements in DCHS. And lastly, we've got a lot of learning resources for nursing and AHP students, and you will have access to this as you come into DCHS. It's all on our intranet page, and a lot of this we talk about in all the forums and all the other sessions that we put together for you. And that is everything on my slide. Thanks, Matt.
Matt, can I just say a couple of things to round off, if that's okay? Okay, so thank you. Thanks for your attention and spending some time with us. I hope you've gained a flavour of the passion that we have of working in community services broadly, but actually the possibilities for you all as students of deciding to come and work within DCHS. The biggest thing we wanted to make sure is that you do not see the fact that you are newly qualified as a barrier to stop you coming and working in the community. And please, if you ever have any questions about community nursing or community therapy, please try and contact one of us and we'll be happy to talk to any of you. Thank you, Matt.
Thank you very much. That was just really, really good to hear. Very inspiring. I have got a couple of questions, if that's all right, and I really don't mind who answers them. But the first question really is about sort of recovering from the pandemic. We're aware as a university from our students' experiences, and we know from what we've seen across all sorts of media input about what's happening in the NHS and in other care services, that things have really changed over the past year or so. Things are being done differently. Remote, I mean, I've been sort of having consultations on the phone, for example, personally. A lot of the GP consultations have been on the phone. There's been lots that's been happening that's different. So if we look going forward at what services may look like in the community, do you feel there's going to be changes as a result of what we've been through, or do you think that we'll revert back to where we were, Michelle?
Yeah, I'll start and then I'll open it up to my colleagues. Within DCHS, and I think broadly, Paula, people are talking about not losing the good work that's happened during the COVID. So COVID has been a terrible time, but actually what it has done is removed a lot of barriers of things we wanted to do previously, because we've had to do things quite quickly. So one of the things that you mentioned is the move to more video consultation or use of telecommunication. And certainly within our services, we're seeing more provision where it's appropriate, because sometimes you do need to have face-to-face services, but where it is appropriate, we are encouraging more people to use things like video consultation or telephone contact. So we're hoping that that will thrive, and we're doing a bit of a research project just to have a look at the impact, particularly at children, young people services, because as you'll be aware, over the COVID, there was a real concern about safeguarding. So it's important that whatever we do, whatever mode we use for our interventions, it has to be safe to do so. So I'm hopeful, actually. We've learned a lot through COVID. We've learned that our staff are really resilient. Our staff have been deployed into different services to support our critical services. We very quickly mobilised the vaccination centre at the Derby Arena. And actually, it was really pleasing to see, because I've done some shifts down there, that you see professions coming together very, very quickly. You talk about what makes a team and needing time to form a team, but actually at the arena, we had a number of professions coming together very, very quickly to enable us to mobilise the vaccination effort for Derbyshire. So I think things will change. There's a very big focus now on how do we actually transfer services into the community, and people are seeing the community as the way to stop admissions going into the hospital, inappropriate admissions, stopping people staying in the hospitals longer than they need to. And for the first time, it feels like everybody's galvanised and everybody's working to the same end. I mean, I said before, since the 80s, people have been talking about care in the community, but it feels like the stars are aligning in a way, and people are actually seeing that there's an awful lot that goes on in the community that's unseen. Highly skilled practitioners, very knowledgeable practitioners who can manage a lot of risk. And that's one thing about community services, you have to be able to manage risk appropriately. So I don't know if any of my colleagues want to add to that. Oh, they're silent.
That's okay. That's no problem. I think you've probably encapsulated the way that we're looking at care going forward across nursing and allied health professions, because I know that all are working differently. So that kind of leads me on, and apologies for, but obviously the last year has been, very, very impactful on all of us. I know that we have registrants in nursing and allied health professions like occupational therapy who have had to do the last 18 months of their education and training in a very different environment. And although we know they're going to be competent registrants, because obviously they wouldn't be qualifying and recommending for registration without that, it might be that they have different preceptorship needs when they move to DCHS if it is their first post as a registered nurse or allied health professional. So what would you be able to offer in terms of supporting students who may have had a very different set of placements over the past 18 months, the confidence to be able to develop the sort of autonomy that you've talked about and the skills that you've talked about to work in the community?
I'm going to hand that over to Faith.
Thank you.
Thanks, Michelle. So one of the things that we've learned, Paula, through supporting the aspirant nurses is that our students are so adaptable and very, very resilient. So they are coming in an environment where it's quite challenging for our very experienced staff and colleagues, but this is the environment. They don't know anything different. So this is what they are being exposed to. So we found that, you know, that's setting them up in a good stead, if you like. But one of the things that we are quite aware of is that we need to do a lot of work into making sure that the preceptorship program that we are providing is not the usual generic preceptorship program. We've seen on the NHS long-term plan, there's a lot of talk about recovery for staff, recovery for the workforce, and we're including our students in that. This is why I talked about access to staff and well-being, because we know that's going to be very, very important for this group of people, so that, you know, they get their confidence before they start, whilst they're starting their new jobs. I don't know if there's anything else Mary might want to add from AHPs or Joe.
I'm happy to add a couple of lines of that. It's Joe. We work very closely as well with the clinical practice facilitators who are on the ground to make sure that what they're picking up from colleagues as they go round and work alongside both students but also newly qualified nurses and others, that's feeding through into the preceptorship. And we've put on some very bespoke sessions for quite small numbers of people in response to some of those issues that have been raised. And it is just a question of people being really honest when they're asked, what do you need? Because we can deliver whatever people want, but we have to know people need it delivering. And I think the other key to people's confidence is to take the clinical supervision opportunities that they're offered, and that they take that seriously, because it really develops not just their resilience but also their skills and their reflective, you know, their ability to reflect on their practice, which I know that the students coming out are really good at. But when you're a registered nurse and the pressures of work are there, and it's your day-to-day job, it's easy to forget that that's so important.
That was really good to hear, Joe. I think in terms of sort of being able to adapt what the skills are that some needs, both Faith and yourself have talked about looking at what students have learned, and some of them may have developed higher skills, of course, in particular areas from what they've been through over the past 18 months. But it's quite reassuring to know that, one, our students have presented as adaptable and they have been able to adapt to new environments and new ways of working, which is great as a kind of graduate skill anyway, for a healthcare professional. But really good to hear that that care's being taken. And it sort of leads nicely on to a third question, really. It was really pleasing in that first slide, Michelle, to see this staff satisfaction of working within Derbyshire Community Health Services. I'm a governor, so I see at your trust, so I do see these metrics on a regular basis, and I'm delighted when I see that not only do we have great staff satisfaction at your trust, but we also see really good quality metrics in terms of patient care and patient satisfaction. So you may not know the answer, but what do you think is the recipe, if you like, that leads to an organisation being able to have really, really good satisfied staff and excellent patient care?
I think it comes down to leadership and culture, I would say, Paula. We have a fantastic Chief Executive Officer in Tracy Allen, and she sets the tone for the organisation. So working within DCHS, I mean, that's the main reason I came to DCHS, was because I'd heard so much about the organisation and knew people who'd worked in the organisation, and I was aware of the culture, the behaviours, the leadership. But I think we try to be transparent. We don't think we've got it all right. We know we've got stuff that we've got to work on. So it's that openness and transparency, but that strong leadership and culture, which we try and be as inclusive as we can so that everybody has a voice and then we listen to that voice, and where we can, we respond to it appropriately. But we don't always get it right, Paula, so I think we're realistic to know that we've still got work to do, but we never stop trying. We want to be innovative, and we want to take our staff with us, and we know that good staff experience means good patient care, and that is the fundamental importance for our organisation.
Thank you, Michelle. I don't know if anybody else wants to offer anything in terms of their experience of working at DCHS.
It's Jo again. I've worked in DCHS and its predecessors for 20 years, and I really don't want to work anywhere else. I can't imagine working anywhere else. I have had the opportunities to do so, and I just love it. And I think the important thing as well is that the organisation has changed a lot, and in the future will also change a lot, which offers challenges. But because we've got such a good executive team and such a good board and Council of Governors, actually, Paula, I think it's possible to feel it feels safe to make those changes, and there's a lot of engagement with staff in services, not always as well received as you'd hope, but it's genuine. And I think people are all pulling in the same direction. And I think the future is for DCHS is really positive and looking really quite exciting as we look at how we work within integrated care services. So I certainly don't want to work anywhere else.
Thank you, Jo. That's really helpful. I've just got one final question, if that's all right, and that's probably relates to the video that we saw, which demonstrated the variety and range of the type of care that you offer within the community. And I wondered if you would just say a little bit more, because there seems to be a misconception that community is about looking after just older people in their homes, which is incredibly important because it's the safest place for older people to be cared for. But clearly care in the community is far, far more than that. And if you look at the sort of, you showed that map of Derbyshire, it would be helpful to know the kinds of services that you offer and just articulate the opportunities that students might have for that variety within DCHS.
Okay, I'll start, then I'm going to open up to Jo and Mary and Faith. One of the things we didn't highlight, which I was writing down as Jo was talking, is our urgent treatment centres. So this is an opportunity for, it's almost like, it's minor injury. We've got 8 minor injury units across Derbyshire. They're like pseudo A&Es, so they don't deal with the complexity, but they deal with minor injuries. So the reason why I'm saying that is because I think that kind of talks to the range of things which happen within our community services. So at the one hand, we've got the children, we've got the preventative work with the children and young people services, making sure people live and grow healthy. And then at the district nursing side, it's about allowing people to die with dignity. And we do everything in between. So as Jo alluded to, we've got the 8 urgent treatment centres, we've got our community hospitals, we've got our GP practices, we work from a number of health centres, and then we work in people's homes and in schools, etc. What that offers us, we take any opportunity. So Paula, if we think that something is provided in the acute which could easily be provided safely within the community setting, then we'll start those conversations. Now it has to be, of course, it has to be agreed that it's risk appropriate for that to happen in the community. But what I always find is that our staff are so highly skilled, so knowledgeable, so able to, they're risk assessing, they're doing clinical assessments every single day. And sometimes they don't even realise that they're doing it. So they're so tuned into the safety, the risk, the clinical assessment of individuals they're dealing with, that I think the world's our oyster in community. I think we just need to make sure the infrastructure's right, we give our staff the right training, we have the facilities, and then actually the world's our oyster, would be my perspective. I don't know if anybody else wants to add.
Thanks, Michelle.
I think that's it.
Okay, that's absolutely fine. Well, just a big thank you, Michelle. I don't know if there's any sort of final comments that you want to add, but I just want to thank you and to thank Jo and Faith and Mary just for telling us a little bit more about what the community is, who might work there, exploding some myths, particularly we know that there's a huge myth that people, when they first register, shouldn't really go and work in the community. They should go into acute first and get some years under the belt before they go into community. But it's good to know that the right amount of support, of preceptorship, and opportunities for people as soon as they register are there in the community. So we will certainly get that message across. I'm really looking forward to distributing this talk that you've all done today, so that we can get people in their own time now to be able to look at this and ask questions. So I think that probably the very, very final thing is just to ask, if people do want to learn more about how to get a job or how to come to DCHS, where would they see jobs advertised, and how would they know that they can come and work for your trust, Michelle?
There's a few points. So they could go on the DCHS website, so the internet. They could go on NHS Jobs, because we do have our jobs and vacancies there as well. But Paula, myself and Jo, Mary and Faith, we can make sure that you have our email addresses and contacts. And if anybody wants to talk to us about a career in the community, we'd be more than happy to have a conversation with them. So we'll make sure we send our details across to you.
That's really helpful. That's really good, and thank you so much again.
Thank you.
As I said at the beginning, I spent a lot of my years working in lots of communities, from looking after parts of England and Scotland to looking after parts of North Germany for mental health. And I think one of the things that I loved the most was what was described in your videos was the autonomy.
Yeah.
The decision making is about you developing the skills and expertise to make decisions and rely on those. And I think that that's just one of the qualities that we want to nurture in our students, so that when they come to you, they can rely on themselves and be self-reliant and develop that autonomy. So thank you for giving us the insights that you have. Really enjoyed listening to all of you, and I think it's been really helpful as well to have something other than nursing, because we've got the allied health professions that are incredibly important. It is about that multidisciplinary team. So thank you very much, and look forward to seeing you all probably in a meeting sometime. Take care, and thank you.
Bye.
Bye.
Bye.